Hey, good morning, everyone. My name is Vivian. I'm a medical student from the UC Davis School of Medicine, and myself and a couple of wonderful members from my team are here today to discuss the initial results of a study we did to try to improve backup plan documentation for adults with type 1 diabetes. So a little bit of background, 60% of adults with type 1 diabetes are on insulin pump therapy, and the pump site failure accounts for about 57% of diabetic ketoacidosis events among pump users. And professional societies like the ADA and the ADCES have recommended that patients have a pump backup plan to mitigate this risk. So what was the problem we kind of saw like with the patients we chart reviewed? Complete backup plan documentation, which we defined as having an active basal insulin prescription, but also instructions on the dosing of the insulin and their pump settings available in an after visit summary. They were often absent or they were placed inconsistently in Epic. So our aim was between November 2024 and August of 2025, a period of 9 months, we wanted to increase complete backup plan documentation by about 15% and also standardize it using a feature in Epic called insulin instructions. So firstly, we did a retrospective chart review where we kind of looked at the frequency of the patients having the necessary components of a backup plan just at baseline. And what we saw was that patients more often than not did not have an active basal insulin prescription despite actively being on pump therapy, and that a majority of patients did not have all components of the successful backup plan, whether they're missing the active basal insulin prescription or missing some kind of documentation of a backup plan anywhere in the chart. As a matter of fact, a majority of the patients did not have a backup plan at all in the EMR. And for the patients who did actually have a backup plan documented, the location of this backup plan kind of varied very widely across providers. So we first we also then surveyed our adult endocrinology providers and asked a few questions. And one of the questions we asked was, how do you document a backup plan or communicate a backup plan to patients that you talk to? And again, the methods varied widely. Multiple methods were often used together, which, a combination of I just kind of talk to them about it like during the visit. I use free text or I kind of document it in the actual prescription text of the basal insulin prescription. And we saw that even though a lot of our providers heavily relied on using Epic to document pump settings or CGM settings and to prescribe the active basal insulin, knowledge of Epic's insulin instructions was pretty much non-existent. Many providers didn't really know how to know about it or have not heard about it. So what did we do about this? Oops. So our intervention then was first at a division meeting, we provided re-education on what a complete backup plan was for pump users, which again included having an active basal insulin prescription, but also having instructions available to patients in an ABS. And this intervention included a instruction video that was made by our team, kind of documenting and kind of going over like what insulin instructions was, how to find it, and how to use it, which we won't show the whole video right now, but there's a QR code available if you were interested in finding where it was. But the upshot of this is that insulin instructions is kind of feature that you can find on the snapshot view or also the medication orders tab to Epic. It's a template that you can use to fill in pump settings, backup basal insulin instructions, and with a smart phrase insulin instructions it will pull this template immediately into both the note and also the patient's ABS. And this can be refreshed every single time you have a visit or in between visits so that patients always have an up-to-date backup plan and also basal insulin instructions when pump failure happens. In addition to the video that we shared, we also placed step-by-step guides on how to access and use Epic's insulin instructions provider workspaces, just for reference if they weren't able to find it the first time or they're having trouble locating it, when they had clinic days. So over the 9 months after the intervention, we kind of assessed change in the complete backup plan documentation and the usage of Epic's insulin instructions after we provided this education. And we saw that our Epic insulin instruction usage increased from 0 to 27.9%. So having some variable engagement there. But overall, after re-educating on what a complete backup plan was and what that should consist of, the complete documentation of both an active basal insulin prescription and also instructions for the patients in an ABS and increased significantly. And this wasn't included in the slides here, but we also had data that showed that active basal insulin prescription also increased by about 20%. So we went from a majority of patients having no active basal insulin prescription to a majority having an updated insulin prescription that they can use. So what are our next steps? Where do we go from here? We would like to resurvey our providers again, just to continue to engage with them on if they're using Epic's insulin instructions, how they're feeling about it, and continuously kind of checking in on how they're communicating a backup plan to patients on pump therapy. We want to have continued education on accessing and implementing Epic's insulin instructions and continue showing them how to use it. Again, it's usually found in the medication and orders tab, but there is now an easy way to access it with the snapshot view on Epic. And hand in hand with that, we would like to do an annual technology update clinic where we gather and we show providers like how we can utilize this tool in the care of our patients with type 1 diabetes. So our takeaways are that from this intervention, we significantly improved our backup plan documentation overall and increased Epic's insulin instruction utilization, though again limited by variable provider engagement, but hoping that we can improve that, as time goes on. All insulin pump patients should have a backup plan documented in a standardized location because inconsistency of this documentation jeopardizes safety. If we're not able to find this information or the most current pump settings or a backup plan available, that can really be disastrous for patients' blood glucose control. And to tackle the issues of both the lack of complete backup plan documentation and also the standardization and the ease and availability of where you can find it, we recommend using Epic's insulin instructions because of its ease of use and its success with our pediatric colleagues who have been using Epic's insulin instructions for a while prior to us starting this. So again, I have the QR code up to the instruction video if anyone is interested, but thank you for your time.
Thank you. That was really great talk, and I'm ready. Thank you so much. Great to see you as a medical student here presenting. I'm Lisa Wolf from Johns Hopkins. One of the questions that has come up for us, in addition to providing the backup basal insulin as well as the instructions to, switch over to basal bolus when you have a pump issue, is in children, the doses diabetes is very dynamic and the doses are always changing. So we've been reluctant to put exact doses into the ABS because if they pull up the papers from a year ago, they could be very different. So how have you guys addressed that in this program to make sure that we're making sure we're giving them the most up-to-date doses?
My team members would love to answer that.
Hi, I'm Carrie. I'm from UC Davis Pediatrics. I'm not part of this study, but we have implemented all this stuff for a while. And so we're happy that our adult colleagues started to kind of use the system the way we do. I would say that in peds, we obviously see the same thing where we are. And I'm very lucky that my colleagues and I are very dependent on this. And so as a result, we all have incorporated it into our workflow so that if anyone calls, if you make any changes, we all update it. So in each encounter, you can access it and change it. And I actually work on the inpatient side for the majority of the time. And it's really helpful because it's almost always updated. And then on the inpatient side, if I make any changes, I update it. So I think it just needs to be part of the workflow and understanding that this is the way that you're communicating to everyone, that I spoke to this person and we made these changes so that the next person going forward has a way to access things without having to like read through everyone's notes and things like that.
That's for like the current.
Yeah.
What about backup for basal bolus? If you're switching off a pump and you give them a specific number.
Yes,
It might be different 6 months from now when they come to us.
that's true. We make a point of doing it at least every year in our annual visit. And then it is kind of tricky because I think that can fall through the cracks, but usually the providers will try to update that as well. But yes, it's less reliable.
Inpatient, but adult as well. And we, from our inpatient side, we do, so they may go home on different pump settings, but the backup plan is right there in the insulin instructions. You'll see if you watch the video, so that we actually actively change the basal, and mealtime doesn't change as much sometimes, but we're actively changing it every time. We did not have a great engagement, but it's actually improved. We have this endocrine snapshot now that has the insulin instructions really accessible, and then we have a smart form underneath that with diabetes overview that's been helpful to kind of get provider engagement. Pizza's been great, but.
Thank you. This is great. I'm amazed that you're all doing this. Just a quick follow-up from me personally. Yes. How do you have, so I use the insulin instructions all the time during the visits, but it takes time to manually enter all this information. So I'm very impressed that you're actually doing and have time doing this.
I think once you do it once, maybe then.
Yeah.
After that, the first time.
This is mostly just a comment actually to your question of what we do in our pediatric space. So we definitely make a point at each follow-up visit to update the EVS with settings and stuff like that. And as an educator, part of what I do with my patients is, especially for like Omnipod, your total daily and what you get in automated basal might be different than your settings. And so I think as educators, that is something that we focus on, and we might say, hey, this is what your Lantus dose might be. Another initiatives that we've done is actually teaching families how to access their own settings for pump failure. If their pump dies, this is how you access your settings to program a new one. And that's been a really big push to kind of encourage autonomy. And so with that, we might say, hey, this is your Lantus. Double check and see if this is kind of close. And if it's not, then call us. And I feel like that's been really well received. To put ownership on the family to like know where their stuff is, so they're not just kind of at a loss. So that's what we do.
This would be our last question.
And less of a question and more of a comment also to Lisa's comment about how do you keep up with the doses. So begging and borrowing is stealing shamelessly from Mercy Children's. We created a ketone sick day calculator. So our diabetes sick day is a website that you actually go to. And again, we teach them how to go to find their total daily doses and total daily basal, and they can put that in the calculator, and then it'll calculate their ketone corrections as well. And we also have medication reconciliation. Probably every institution should have medication reconciliation. So part of that medication reconciliation is, do you have backup basal? And so making sure that it's on the medication list is another opportunity to make sure that those are updated frequently.
Great, thank you.